Welcome to Heart Attack Awareness. If you're a woman over 40 or if you care about one, this could be the most important video you watch today. Heart attacks don't always come with the kind of dramatic signs you see on TV. For women, the symptoms are often subtle, unusual, and tragically easy to ignore. In fact, many women don't even realize they've had a heart attack until much later, or they chalk up early warning signs to stress, fatigue, or indigestion. Sadly, these missed signs can lead to fatal outcomes. Let's start by debunking a myth that heart attacks always start with sudden, crushing chest pain. While that can happen, especially in men, many women experience heart attacks differently. Their signs are often more like whispers than alarms. Small discomforts that grow worse over time, sensations that seem unrelated to the heart, and sometimes there's no chest pain at all. One of the most overlooked symptoms is unusual fatigue. This isn't just the tiredness you feel after a long day. We're talking about a deep, bone-weary exhaustion that makes everyday tasks feel impossible. If you suddenly feel like walking across the room leaves you winded, or like you can't lift yourself out of bed for no clear reason, that's a red flag. Women have reported feeling like they were coming down with the flu, or just not right in the days or weeks leading up to their heart attack. Another common but underappreciated sign is sleep disturbances. This includes trouble falling asleep, staying asleep, or waking in the middle of the night drenched in sweat or gasping for air. You might chalk it up to menopause or stress, but it could be your body's way of telling you that your heart is under strain. If you notice these changes and they're sudden, don't ignore them. Shortness of breath, especially when it happens during normal activities or while resting, is another symptom women often report. Maybe you find yourself out of breath climbing stairs, walking to the mailbox, or even while talking. That's not normal, and it's not just aging. It may signal that your heart isn't pumping effectively, which means it's struggling to deliver oxygen to your body. Many women experience pain in places other than the chest. Discomfort in the jaw, neck, shoulders, upper back, or arms, particularly the left side, can be a sign of heart trouble. The reason: the nerves from your heart connect to these areas, so your brain might misinterpret the source of the pain. This referred pain is often misdiagnosed as arthritis, muscle strain, or even dental issues. Nausea, indigestion, or stomach pain are also common in female heart attack patients. You may feel like you have a stomach bug that won't go away, or heartburn that behaves differently than usual. A feeling of bloating, burping, or pressure after eating, especially if it happens suddenly or without a clear reason, should raise suspicion. There's also the emotional side. Some women feel an overwhelming sense of anxiety, fear, or dread in the hours leading up to a heart attack. It can feel like a panic attack or a wave of doom. These aren't just feelings. They could be your body's neurological response to cardiac distress. If you have a sudden surge of anxiety accompanied by other symptoms, get help. So why are these symptoms so often missed? First, many of them don't match the classic heart attack image. Medical professionals are trained to look for chest pain and arm numbness, symptoms that are more common in men. Women over 50, especially those post-menopause, are at even greater risk. The protective effects of estrogen wane, blood vessels become less flexible, and risk factors like high blood pressure, diabetes, and cholesterol become more dangerous. Add smoking, sedentary lifestyles, and high stress levels, and the risk multiplies. Another major issue is misdiagnosis in emergency rooms. Studies show that women are more likely to be sent home without proper cardiac testing, especially if they're younger or don't describe typical symptoms. That's why it's so important to advocate for yourself. If you feel something is wrong, insist on tests like an EKG, blood work, or stress tests. It's better to be wrong and safe than quiet and at risk. So what can you do? Start by knowing your risk factors. These include high blood pressure, high cholesterol, diabetes, obesity, smoking, a sedentary lifestyle, and family history of heart disease. If your mother, sister, or aunt had a heart attack before age 65, your chances go up significantly. Talk to your doctor about your numbers and track them regularly. Daily habits matter. Eat a balanced diet rich in vegetables, fruits, whole grains, lean proteins, and heart-healthy fats like omega-3s. Cut back on processed foods, sugar, and excess salt. Hydrate well. Exercise daily. Even 30 minutes of brisk walking can reduce your risk. And don't forget strength training, which helps control blood sugar and blood pressure. Manage stress as a serious health priority. Chronic stress leads to inflammation and higher cortisol levels, which burden the heart. Try deep breathing, mindfulness, journaling, or simply spending time outdoors. Laughter, friendship, and quality sleep are as important to your heart as diet and exercise. Try deep breathing, mindfulness, journaling, or simply spending time outdoors. Laughter, friendship, and quality sleep are as important to your heart as diet and exercise. Stay alert to how your body changes over time. Don't accept new, unexplained symptoms as just part of aging. Pain is a signal. Fatigue is a signal. Breathlessness is a signal. And together they form a pattern that should never be ignored. If you think you or someone you love might be having a heart attack, don't hesitate. Call emergency services immediately. Chew an aspirin if you're not allergic. Stay calm. Sit or lie down with your head elevated. Do not try to drive yourself. Every second counts. Let's close with a powerful reminder. Heart disease is the #1 killer of women worldwide. It claims more lives than all forms of cancer combined. So share this video. Talk to your mother, your daughter, your friend. Help them understand that a heart attack might not look like what they expect, but it's no less deadly. Let's empower women to listen to their bodies, advocate for themselves, and take their heart health seriously. Thank you for watching Heart Attack Awareness. If this video opened your eyes or taught you something new, please hit the like button, subscribe to the channel, and tap the notification bell so you never miss life-saving information. Together, we can save lives, starting with your own.